We are streaming live spine surgery. Our patient presents to us at Deuk Spine with 40 years of back pain. She's now in a wheelchair, unable to walk without assistance. She uses either a walker or a wheelchair. She's already had a spinal fusion done in Texas. Now she has problems related to the fusion, like adjacent segment disease, degenerative disc disease, herniated disc, stenosis, radiculopathy, myelopathy. She's got a large herniation at T12L1, which is the first one we're going to fix. Now, Anthony, let's share with our audience the 30 different causes of back pain before we get started here. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us.
Look at this. Look what just came out. There is her major herniation. You guys see this?
Now we do.
All right. Here.
Yeah, that's huge. Yeah.
Can you see this? I just pulled this out of this tube. So that's the beauty of the Deuk laser disc repair. Ultra minimally invasive, 1/4-inch incision, and I just pulled a giant. Okay, the incision is 1/4-inch, 7 millimeters, and I just pulled a. How big is this thing?
4
It's like
centimeters.
an inch and 3/4. Yeah. So out of a 1/4-inch incision, I pulled out this huge piece of herniation. That was pushing on her spinal cord, causing her to go paralyzed. Now, any other surgeon would have done a laminectomy, foraminotomy, partial facetectomy, remove ligaments, cut the muscles, put in screws and rods and cages. That's what they wanted to do to her. They wanted to screw her. But she said, no, I'm tired of these surgeons just recommending invasive treatments that are painful, long recovery, high risk of complication, expensive, require hospitalization. I want something better. So she chose the newest, most advanced treatment in the world for disc problems like hers. She had a herniated disc. There's still a little bit of herniation there. I'm going to go get it. She chose the Deuk laser disc repair. And we're going to fix her 4 discs, 4 areas on her discs today during the surgery. We earlier streamed this, but unfortunately we had some issues, technical issues with our software, right, Anthony? So
Yes.
now we're back and we're going to hopefully have a nice stream. If you have questions, feel free to ask me. You can type your questions up on LinkedIn, Facebook, YouTube, or X, and I'll be happy to answer them for you. There's the annular tear. Hold the tube right here. There's the annular tear. There's a little bit of herniation left in there, and I'm using this medical laser, which is FDA approved, to remove the rest of the herniation. I use the laser, but I also use grabbers, metal grabbers, which most surgeons use, called pituitary rongeurs, to help remove the herniation. There's some more herniation right there. So I'm going to use some more grabbers. You got to hold that too. Okay? You cannot let go. Any questions?
Yes. We have a question from Lanu on YouTube.
Sure, I'll take Lanu's question.
Can herniated disc be measured like cancer? For example, cancer has stage 1, 2, 3, and so on?
Yeah. Great question, Lanu. So the question is, do you guys stage herniated discs? The answer is no. Now, some people have tried, but there's really no point in staging a herniated disc. It doesn't change the prognosis. The prognosis is determined truly by the surgeon who's doing your surgery. If you have a bad surgery, your prognosis is bad. If you have a bad surgeon, your prognosis is bad. If you have a good surgeon, your prognosis is good. More important than anything, any physical characteristic on the MRI is who's doing your surgery and what kind of surgery are they doing. If you want the best prognosis for results, you have to go and get the best treatment. That's what Deuk Spine Institute offers. Our patients get the very best treatments in the world for their problems. We are able to do any spine surgery that any spine surgeon can do. we choose to do laser surgery because it has the best results for the patient, not the doctor, the patient. A surgeon, when they're choosing the surgery to recommend for a patient, is considering the best results for the surgery. And a lot of surgeons today think about what's the best result for them. What's going to make them the most money? They look at a patient and think, how can I get the most money from this patient's insurance, for example? And sometimes getting the most money from a patient's insurance means that you have to do more than one surgery. So you may offer the patient go visit my friend, the pain management doctor, first, and then after they do a bunch of shots that take 6 months, a year, then come back and we'll do a laminectomy. Then when the laminectomy is finished, patient go back and get more pain management and more shots, more treatment from the pain doctor, from the physical therapist. So everybody's making money on the patient, except the patient's not getting better. They're still in pain. That's typical today in 2026. What's happening? Happens all the time. The surgeons are choosing the best treatment for them financially, whereas the patients want the best treatment. So at Deuk Spine Institute, we always put our patients' needs first, ahead of ours. That's why we offer our patients the best treatment, not the best treatment for us, the best treatment for the patient. It's a very different philosophy than most other doctors today that are offering treatments that they know are going to result in more treatments down the road. So if you want the best treatment available, then you need to go to the surgeon who offers you the best treatment available. Deuk Spine Institute does that. Now, some of you may say, Dr. Deuk, you're so brutal. Yes, in this day and age, you have to be brutally honest because nobody else will be. Look at that. There's the other big herniation. It's not as big as the last piece, but check this out. You guys see this?
Yeah, we
All
see
right?
it.
So there's major piece number 2. Now I want you to take note of the color. The color is pink. Why is it pink? Because there's so much inflammation. Her body has been trying to fight this herniation. It's like David versus Goliath. Her body's inflammatory system trying to get rid of it. It can't. It's too big. Okay, we're done on this side. I'm going to just take one more peek, make sure we got everything. But what a beautiful surgery. There's a little bit left right there. I got to pull that out. Hold the tube. Oh yeah, another big piece. Look at that. So I think now we've got it all. Look at this. All right, so that was what was pinching her spinal cord. That's why she was losing strength in her legs and struggling in a wheelchair. Now she's been in a wheelchair for months and months, not just from pain, but also from pressure on her spinal cord. There's the other needle on the other side, by the way. We're about to go on the other side shortly. Any questions?
Yes, we have a question from Lanu on YouTube.
Yes, Lana.
Does herniated disc research exist in the medical community?
Herniated disc research does exist. However, there's not a lot of attention put on it because the problem is most doctors don't understand herniated discs and the funding is not there for the research. The insurance companies realize herniated discs are a very common cause for surgery and they don't want to pay for the surgery. So the insurance companies are doing everything in their power to dissuade and keep patients from getting surgery. Come on, Luis, you can't miss pieces like this on their herniated disc. Forget about that. Just give me the knife. Any other questions?
No questions.
Yeah, we know enough about herniated discs today at Deuk Spine that we can do whatever treatment is necessary to get you well. If you have a herniated disc, if you have a degenerated disc, if you've got a bulging disc, if you've got back pain, come to Deuk Spine. We will tell you exactly how to get rid of your symptoms. South. It is no longer a mystery to us at Deuk Spine. It's still a mystery. The herniated disc is still a mystery to all these other doctors out there trying to treat herniated disc problems. It is not a mystery at Deuk Spine. We know exactly how to cure your symptoms from a herniated disc with minimally invasive treatments. That's what we do. We do the most advanced, most minimally invasive treatment that cures the symptoms shot from a herniated disc. But you got to come to Deuk Spine to get that treatment. It's not available elsewhere. Any other questions?
No questions.
That's it? All right, folks. I know you can't see the x-ray here, right, Anthony?
No.
But we are now on the left side at L5S1. This patient had a fusion with instrumentation, pedicle screws, bilateral, L4, L5S1, segmental with rods. But the surgeon left the herniation there on the left side, and it is still pinching the nerve root going down her leg. So we're going to go into an area that was already fused, left L5S1, and we're going to go and treat that area right now, okay? Because they put a cage, hold on, they put a cage there, okay? But they left the herniation behind the cage. So this poor woman has been suffering with back and leg symptoms. And I know you can't see the cage because we can't see the x-ray, but wow, it's impressive. We're right behind the cage on the left side. I'm going to go in there and remove that herniation so that she can get some relief. This is a common problem, folks. Surgeons doing bad surgery that leaves the patients still suffering in pain where they did surgery because they didn't do the right surgery the first time. In this case, the surgeon that put the cages in, these artificial discs in, they should have removed all the herniation behind the cage. But instead they went through the belly and they put the cages in through her belly. When you go through the belly, it's the highest chance of complications. Also, you can't get rid of the herniation. Watch out. You can't get rid of the herniation because you're going through the front of the disc. You can't see the back. So they literally push the herniation backwards into the left foramen at L5S1. And now I'm going in through the back, the proper way to remove the herniation. This happens all the time, folks. Patients are going and getting the wrong surgeries. Why? Because their surgeon doesn't know how to do the right surgery. So the surgeons are just going to do whatever they know how to do, whatever works best for them financially. So here we are inside L5S1. We are literally right behind the cage that was put in, the artificial disc that was put in by another surgeon. We may actually see the back of the cage here. Any questions? It's all scar tissue right here, by the way. Scar tissue and herniation. All of this. This is what was pushing on her nerve. I just shoved it back in, and now we're going to use the laser to remove it. Any questions?
Yes. We have a question from Lanu on YouTube.
Hi, Lanu, go ahead.
Did this patient find you after she had a fusion?
Yes, this patient found me. She lives in Texas. She's a professional. She was suffering, just getting worse and worse. She used to be walking around like a normal person, but the back pain, the surgeries, the fusion, all of that just put her in a wheelchair. So she was at the end of her options, and she stumbled upon our website and our videos and learned about our treatments here. So she decided to come after she did a Zoom call with me, a consultation that was free. We offer free consultations for anyone in the world that wants one. She came here and she got it done, the consultation, and now here we are doing her surgery. What is that?
Vibration of the foam. Can you put a foam there?
All right, there's a piece of herniation at L5S1, left foramen. Now, I'm going to reach in there and try to pull out some more, but look at all this scar tissue. There's the back of the cage right there. You guys see it? It's literally at the bottom of that little chasm That is the cage. That's a polyether ether ketone cage, aka peak cage. And if you just watch for a second, I'll show you maybe a little more. So this is why we don't do fusions, folks. It leads to more surgeries for the surgeon, more surgeries for the patient. They have to come back and get additional treatments because these fusions cause problems. So the cage is literally right there. I'm rubbing the laser on it. It's hard to see because it's the same color as the scar tissue. See it right there? That's it. Right there. That's the cage. And look at the laser. It's going to melt right through it. Okay? But we're not here to mess with the cage. We're here to get rid of the herniation behind the cage, which is all of this material. Sam, what can you do over there? Trying to do what? What's causing it? Are they good vibrations? You like that, Berndes? Good, 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 good vibrations. Bubbly orange juice sensations. The Beach Boys. That was high school, man. All right. Any other questions from our audience? I graduated in 1987. High school. It's around the time the Beach Boys put out that song. 70. You were born in 65? All right. Really? Nice. You know, that was back in the day when great musicians came to the United States to play. And we appreciated it as a country. We welcome them. Now we fight them off. Don't let them come. Unless they're, unless the people that control the music industry in America who took it over back in the 90s, unless they're making a lot of money off the artists, they're not going to let them come to America and perform. Any questions from our audience? We're almost done at 5-1.
Yes, a question from Lanu.
Yes, Lanu, happy to answer it for you.
Will the cage stay in her body forever?
Will the cage stay in her body forever? The answer is yes. The cages will stay there forever. There's no reason to take them out. Once they're in, taking them out will only cause more problems for the patient. It's always better not to put cages in your body, but now that there is a cage there, I cannot remove it. I mean, removing it would be a massive undertaking and it would be very dangerous for complications for the patient. So just the better thing to do is don't put a cage in. We're done with this disc. I got to go to the next. Let's show the audience how discs will be so painful. How are disc injuries like herniated disc, degenerated disc, so painful for the patient? How do they cause symptoms?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Bring it out. Bring it out. Welcome back. I don't need that there. Just go bring the cover. All right. You can see from our video how the annulus, which is a ligament holding the bones like L4, L5, L4 to L5, the annulus, which is a ligament that's circular. It runs around the bones and it holds the bones together trauma, like an injury, car accident, slip, fall, tears that ligament and allows the jelly from inside to squeeze into the tear. Once the jelly squeezes into the tear, it's going to cause problems for the patient. I need you to hold this here. Monica, I need you to help me. Grab that and pull it around the bottom. There, grab that and pull it around the bottom. Very good, nicely done. All right, we just changed our fluoro cover, which is a sterile thing. We're gonna move back to the right T12L1, which we didn't do yet. We did the left. Remember we got all that herniation out on the left side? Now we're gonna go to the right side shot. Right there's nice incision. Go ahead. Go ahead. Yep. Any questions? That's good. Any questions, folks?
Yes, we have a question from Lanu. Last question. What will you do with the herniated pieces? Maybe the patient can see and understand how severe her condition is.
Yes, we're going to send those to the lab where the doctor at the lab will measure them and document them for the records. The patient will be able to see them shot when she watches this video. Oh. She's just hiccuping, coughing. Probably a little coughing, right? All right, great question. Shot. Okay. Get Hector. Do I need to come out? Come out? Come out? All right, we're going to go ahead and end the stream.
Sitting on.